Can a small to medium crease for Asian eyelid surgery be so swollen that it temporarily looks like a very large crease? Biting the bullet here and posting some pictures, as I had wanted to stay anonymous and not post any pictures, but I know it's very helpful for me when I can see photos of real self members. Plus, I hope I'll get more answers to my questions and concerns from doctors and other members by posting some pictures. Is it possible for a small, medium eyelid crease to temporarily look like a very large crease? Will it decrease in size over time by at least 50%? When should I be concerned if it doesn't?
Thank you for your question. You submitted several photos and you're asking a very straightforward question. Could a small to medium eyelid crease after surgery look like a very large crease? And you submitted several photos that show significant swelling between the eyelid crease and the margin. Well, I can certainly give you some guidance on this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. Asian eyelid surgery is an area of specialty in my practice, and I can certainly give you some guidance on what I expect and what I tell my patients to expect after eyelid surgery. So to begin with, whether it's a non-incisional approach or an incisional approach to Asian eyelid surgery, there's a meticulous planning process that is critical to the success of the surgery. And that's basically setting the ideal crease of the eyelid when the healing is done. Now, whether it's non-incisional or incisional, there's always a certain connection that has to be made between the skin and the levator muscle. The levator muscle is the muscle that lifts the eyelid, like the word elevator. Now, to create that type of connection, sutures or stitches have to be placed in a way that connects the skin to that muscle. So it is very common to have initially swelling that makes that crease look enlarged. And basically, it's almost like a compression where there's a narrow space where fluid will collect until the body clears it out. And that fluid can be present for weeks to months. Then rare occasion, it can even go beyond up to a year. And so what I tell my patients is that in the beginning, your crease is going to look high and large and much more than you wanted. And sometimes patients will come in and be concerned that the swelling on one side is different from the swelling on the other side. And of course, that's normal also. So what I explain is that basically the first month is usually when the swelling is at its most. There are several important wound healing stages that occur in the first month, from the inflammatory stage to the proliferative stage. And then after that, there's what's called the wound remodeling stage. And that goes on for a year and even beyond. But the point is that that swelling can really take its time. And not that it's going to be the same throughout the period of healing, but the first month or so is definitely when it's at its peak. But it's not at all unusual to see it still present and lingering into the second month. For most of our patients, when I see them in the third month visit, I can see a mild degree of some swelling, but socially it's usually not that significant. So to answer your question, is it normal to have a small to medium crease look like a large crease? The answer is absolutely yes. And in fact, it's typical. It's the rare situation where someone has so little swelling that they would look exactly the way they would look in 3 to 6 months as in the first couple of weeks. It's just not typical. During the surgery, when I set the eyelid, I'll sometimes have the patient open their eyes to make sure that I like the way the crease is folding in. But even during surgery, because of anesthetic, there's still going to be some swelling. So that's why the planning before the surgery and the markings are so important in terms of measuring and placement. But I'm sure that the doctor you chose to have your surgery with inspired enough confidence in you to choose the doctor. So I am certain that this discussion has already transpired, but it's okay to naturally want to be reassured. I would recommend you continue following up with your doctors during your follow-up visits. Ask about the degree of swelling and if it's normal, and of course bring to your doctor's attention any other concerns you have during this healing process. But as in our practice, we see people at 1 week, 1 month, 3 months, 6 months, and then as often time in between as any patient needs to come in, just to be sure. It's a lot easier to make those evaluations in person rather than from a distance. So I hope that was helpful. I wish you the best of luck, and thank you for your question.